I'm Mike Gibson and Manos Brilakis coming to you live from SCAI 2016 talking about cataracts and occupational health risk and interventional cardiologists. Manos, talk to us about the magnitude of the problem with cataracts and interventional cardiologists.
Sure. We don't know the full magnitude, but there are a couple of papers done in Solasi, actually, in Latin America, and they found between a third and 50% of interventionalists had some opacities on the back of their lens.
And how aggressive are you in looking for those opacities? I mean, what was the methodology?
So this is a full dilated exam. So what they did in Latin America is they went and they had got the eye drops, they got a full dilation, and then 20 minutes later they examined the back of the lens and what's called the retroillumination to get a good look. So they found even the very small opacities that are hard to find otherwise.
And were these guys symptomatic? I mean, it sounds like a scary number. I mean, were these people symptomatic with those opacities, or they're asymptomatic?
Well, I think most of them were not symptomatic. We don't know for sure, but most of them were not symptomatic. But the point is that you're going to get a cataract anyway at some point in life, but I'd rather get it when you're 70 rather than when you're 50. And the whole point is, protecting our eyes is an important theme, especially when you do high-risk procedures and long fluoroscopy times.
So that gets us to the next question. What can we do to protect our eyes? A lot of guys don't like wearing the leaded glass, but talk to us about it.
Well, that's a good point, because even myself, to be honest, I have 2 pairs of leaded glass, and I get such a big headache when I wear them. That's the weight and the way it looks, that actually I don't wear them very often. But the eyes get radiation as part of the scatter from the patient, so whatever you can do to reduce the radiation for the patient, that's going to reduce the operator radiation as well. So,
and it's important to note, these aren't just lead here. You have to have the lead on the sides too.
Yeah, absolutely. If you're going to have leaded glasses, they have to be on the side, because we're looking at the screen, and
because the radiation is coming from this way, yes.
Exactly. I mean, if you are lucky enough to have the zero gravity, of course, then you're fully covered, but there are very few labs that have that.
Right.
And of course, there's the robotic systems, which you're sitting in a cockpit and get much less radiation. But for most people, having the good habits, don't step on the pedal unless you really have to.
Right.
This heavy foot syndrome where people step on it even though they don't look at the screen.
Right.
And place the patient properly, the eye is touching the patient, and put the shield next to you. I think that can go a long way to
all the usual practices. And you're doing cataract screening here. Talk to us about that.
We are. It was actually an idea that came during ACC. There's a SCAI meeting at ACC, and we felt there would be a lot of interest on that. So we had a big team from our institution. Actually, the Dallas Research Corporation is the one who funded this. And we had my biological ophthalmologist came all the way over, and in the last 2 days or so, we've screened about 130 people, participants. So a lot of people were very excited about it.
And in 15 minutes, can you take your lens out and replace it? Or
that part is for the next guy.
I see. Wow. So that's fascinating. Now, if I go to the ophthalmologist regularly and I had LASIK done, is this the kind of thing they would pick up on a traditional ophthalmologic exam or not?
So I think most eye exams, you don't actually get dilated.
Okay.
When you look at, they take glasses for you, they just have you look at some numbers and they look at the cornea, but they don't fully dilate you. So for this, you need to get a full dilation and a really careful exam. So if they dilate you, I think they're able to see it. If they don't, they might not be able to do so.
And where are they doing the screening? I want to go get this done.
Well, you better hurry up, because it's finishing in an hour.
Finishing an hour. Okay, where is it?
It's right at the left of the exhibit hall as you go on the left. It's called the IC-CATARACT. And actually, we also have a full IRB for this from from our university. And we plan to, whatever we find, we plan to publish it and disseminate to people, just to increase the awareness that this is a problem and something needs to be done about it.
Right, great. Well, thanks for educating all of us. Thanks for screening all of us. And thanks for coming to SCAI this year. And thanks to all of you for joining us here live from SCAI 2016.